collaboration with
Africa's health future and who should control it took center stage in Kampala as Uganda hosted the first ever Africa Health Summit, drawing tens of delegates from governments, global health institutions, academia and the private sector. The summit set out a clear mission, shifting the continent from relying on donors and imported medical supplies to building resilient, innovative and self-reliant health systems.
In South Africa, the expansion of the vaccine manufacturing capacity marks a critical step towards reducing Africa's dependence on external vaccine supply chains. Here in Uganda, globally recognized models of HIV self-testing and community-based treatment access continue to bring dignity, accessibility, and innovation into public health systems. These advancements affirm one truth: when Africa leadership, investment, and innovation align, transformation follows.
Uganda's leadership emphasized that the lessons from COVID-19 and recurring disease outbreaks have exposed the cost of dependence, particularly on vaccines, diagnostics, and essential medicines.
Africa imports 95% of its medicines and diagnostics and produces only 3% of the global pharmaceutical output. Our financing remains constrained, with most countries spending less than 5% of their GDP on health, far below the 15% Abuja target. Meanwhile, external assistance for health has declined by 70% since 2021, even as our debt servicing reaches sky limits, over $81 billion by last year. This imbalance is unsustainable. Health is an investment. It is an investment in productivity, peace, and prosperity. As the African Development Bank reminds us, every $1 invested in health yields $4 in economic returns. The time has come to redefine health as a pillar of economic growth and not as a social afterthought. We must build sovereignty in production, in research, and in policy. Never again should Africa stand back and watch, or stand at the queue for the tools that save African lives.
Discussions throughout the day focused on health financing, vaccine and pharmaceutical production, digital health innovations, and the regulatory reforms needed to support Africa's growing health industry.
Let us see this summit conclude with actionable commitments. Let us affirm our promise to embed self-care and community empowerment into national strategies, strengthen research and innovation to inform policy, mobilize domestic financing for universal health coverage and health security and sovereignty.
The delegates also toured exhibitions showcasing Africa-made diagnostics, digital tools and other breakthrough health technologies, some of which are already being piloted in Uganda.
We need intentional policies on financing health product manufacturing. Because at the end, if we have so many manufacturing entities on the continent, these companies will collapse because the investment is so high that you need market.
And the discussion is so right at this time. It is timely that we look inside, we look at our internal capacity, internal strength, internal skills, and we harness those skills to give us the best innovations. And we do believe, and we have no doubt, that in our minds to it, we shall get there.
As discussions continue, Uganda is banking on the summit to cement its role as a regional hub for health innovation and manufacturing, signaling a new chapter in Africa's quest for health independence. Walter Mwesigye, NTV.